Hey everybody, it's 11 minutes past 7 o'clock right now, and time for the Orthopedic Minute with our friends from DMOS. And it's really neat visiting with DMOS, Jackie. We learned so many different things and how they repair and fix things that ail people.
Yeah, and maybe how to prevent some of those injuries at the same time. We all want to take care of our joints, and we have a specialist here that's going to be talking specifically about our shoulders this morning. We're so excited to have Dr. Jeff Davick joining us. Good morning. Thank you for being here.
Good morning. Thank you.
Okay, so you brought in a couple shoulders
I did.
here.
Yeah.
So the weight's on your shoulders, huh?
It is.
Okay.
Right now.
Right now it is. So we're talking about shoulder instability here this morning. And why don't you explain what that is all about?
Well, shoulder instability can really be two types. You can have a dislocation, which is usually a very traumatic injury.
Is that from a fall usually?
A fall, sliding into home base, car accident. It can be anything really that violently pushes the ball of the shoulder out of place. And those require a reduction either in an emergency room or an urgent injury clinic where you need some sedation to relax the muscles, and we pop it back in place.
Okay.
And then you can have an overuse instability, like in swimmers, gymnasts, where the shoulder just kind of shifts around in the joint, and it can shift around to the point where it becomes symptomatic, painful, and limiting to the athlete and unable to perform the way they want to perform.
Is that because you're really wearing out the joint?
Typically what happens in the atraumatic, the overuse injuries, is that the athlete just stretches out the ligaments and the capsule or the lining of the shoulder, and that allows the ball to kind of shift in the different directions. It's not tight.
Okay.
Throwing athletes, pitchers like Kerry Wood with the Cubs when he had the dead arm syndrome, it was because his shoulder was sliding in and out when he would throw.
Okay. Oof. Now, is that the same type of thing that we've heard for years, Tommy John's syndrome? Or is that something totally different?
No, Tommy John is the elbow.
Elbow, okay.
Yep.
Okay.
Yep. Same sport, different
Same sport,
joint.
All those different
yeah.
joints.
Okay.
And now, obviously, not all of us are major league players. How often, would one of us have issues like that? Is that just everyday use? You know,
for the dislocation, it's just bad luck.
Bad luck.
Like throwing out the first pitch at an Iowa Cubs game about 3 years ago. Okay,
but if you're not warmed up.
If you're not warmed up, but you could really do it that simply.
It would be hard to dislocate your shoulder that way. Usually, again, a dislocation is sliding in the home base. You catch the arm wrong, and it forces the ball of the shoulder out.
Kind of an impact type of situation in most cases.
Correct.
Now, I also understand there's a partial and kind of a full dislocation of the shoulder. What exactly does that mean?
So a full dislocation is when that ball of the shoulder, the humeral head, pops completely out of joint.
I don't even like hearing that.
That gives me the shivers.
And then the
down my
muscles
spine.
pull it so tight that you can't get it back in place without relaxing
Without going
doing
in,
the IV.
I see what you mean.
So you have to go in for that. A subluxation,
just kind of does
soccer athlete will say, I did a slide tackle, I felt my shoulder pop in and out real quick, and then they come off the field and they're, I don't know what happened, but something felt funny.
Yeah.
That's a subluxation where it just comes partially out of joint and the muscles can pull it back in on their own.
Ooh.
Now, the telltale sign that your shoulder is dislocated.
If it's dislocated, you're going to be
in pain.
No, because you can hurt your shoulder. There's no question about that.
Right.
But if it's out of the joint, is there something that specifically tells you it's out of joint?
It just looks very deformed.
It looks deformed.
Right. So you can have a broken bone. If you break just below the ball of the shoulder, you may have pain and swelling. But if you dislocate your shoulder, it's so out of place that you have a big deformity. You'll have a big dent behind your shoulder, and the ball will be pushed into the chest.
All right.
So let's say, what do we do if that situation should occur?
You hope someone's with you, and then they call 911 and get you into the emergency room or the urgent injury clinic.
Now, what about some of these people that say, I'll pop it back into place for you? Is that recommended?
No.
Okay. Because I've seen that happen on the baseball field, on a softball field, where somebody said they dislocated their shoulder and somebody popped it back in for them. But you would probably still want to go in and be checked out.
Absolutely. Yeah, there could be a fracture. There could be other issues going on as well. So.
Absolutely. We've talked about overuse, so whether you're an athlete or things like that, but does age play into that at all, or other symptoms that kind of go into having issues with your shoulder in that way?
Sure, it does. There are a couple things that keep the shoulder stable. One is the labrum, which is the little ring of cartilage in the shoulder that kind of keeps that ball in place. And then secondly are the ligaments and the capsule or the lining of the shoulder. Is that what you have here? We can show the camera right there, camera number 1 right there to your left.
And what's that bone that's sticking out?
That's the collarbone.
That is your collarbone. Okay.
Yep. Front.
Yep. So
which ones are you talking about here?
Front of the shoulder. So you have all the rotator cuff muscles that are adherent to that capsule. So the younger and stronger and more fit you are, the more you're able to keep that shoulder in place. So a lot of times for those overuse injuries, the mild instability, we'll have people go to physical therapy to strengthen up the rotator cuff muscle so it keeps that ball in place.
Nice and tight,
so that you can throw out the first pitch without having pain.
Okay, that is a good idea.
That is a good idea. But let's talk about surgical options that are out there and treatments in case this is something that you're suffering from.
Yeah, so with the dislocation where it comes completely out, you have to go to the emergency room, put it back in place. Younger people have a high likelihood of redislocating again.
Really?
So we will oftentimes, and it's because they tear that labrum or the lining, that little cartilage ring in the shoulder.
So it's not as stable.
Correct. So we do a surgery to repair that labrum back to where it needs to go so you have a good bumper to keep that ball in place.
All right.
And that can be done through a small incision or arthroscopically. There are 2 ways to do that surgery. For the mild subluxation, they're just shifting around in the shoulder. Typically we try physical therapy first, and probably 80% of the people will get better non-surgically. 20% need a surgery to tighten up the capsule or the lining of the shoulder to keep it in place.
Yeah, just it sounds to me from the conversation we've just had here, it's a matter of things getting too loose, and you have to bring them all back together again so they work properly.
That's exactly right.
Okay.
Now, the other model you brought in that looks a little bit more strategic, like you did a couple more things to that bad boy. Is that showing you what surgery can do, or is that just showing you how it moves?
We've just removed all the muscles from this so we can see the ball and socket joint, and again, it's that socket part that has the ring of cartilage called the labrum that's very important for shoulder instability.
Okay.
Right. Now, is the labor able to be stitched back together again, or how do you repair that?
Yeah, we repair it with the little anchors and sutures similar to the meniscus surgery.
Right, okay, we learned that last week, last week when you were here, kind of like a buttonniere type thing where it just draws it together, it gives it a chance to heal.
Yes.
Okay.
Yep,
But if you are dealing with shoulder pain or an issue such as this, there is solutions out there to make sure everything stays in place and you can have a healthier life.
Absolutely. Try to keep things stable, keep things mobile, and allow the athletes to do what they want to do.
You don't have to live with pain.
No.
That's the bottom line.
Yep.
All right, now where are you located? Where's your office at?
West Des Moines. Des Moines Orthopedic Surgeons, our West Des Moines office.
Okay.
Get more information here, 224-1414. Easy number to remember, are over on Westtown Parkway, right down the street from where we are here. Boy, they do some incredible work, Jackie.
And it's good to know that there's some non-surgical options, but if you need to have that extra work done so you can have your shoulder and mobility back, that's available as well.
Absolutely.
Wonderful. Well, very nice to meet you this morning.
Nice
Thank you so much. Good to see you.
Yes.
All right, it's